What if some of the world's most dangerous diseases were quietly invading your body, without pain, without warning, often without symptoms until it's too late? That's the scary reality. These 10 silent health threats can develop unnoticed, quietly causing damage that becomes irreversible. In this video, we expose 10 silent diseases that can destroy your health without warning and reveal the subtle signs you need to watch for. These seemingly minor changes in energy, sleep, digestion, or vision may be your body's red flags. Symptom number 5 is particularly dangerous and often ignored. Learning about it could be a lifesaver. Subscribe and turn on the bell so you don't miss life-saving videos like this one. Some health threats grow silently. They progress slowly, no pain, no clear warning signs. By the time symptoms show up, it might be too late. That's why understanding hidden signs and taking care of your body even when you feel fine is the smartest way to live longer and healthier. 1. Hypertension, high blood pressure. Hypertension is called the silent killer for a reason. It rarely causes pain or noticeable symptoms until heart attack, stroke, or kidney damage occurs. Most people don't realize their blood pressure is high until they get checked during routine exams. Common early clues may include morning headaches, dizziness, or shortness of breath during daily activity, but these can be easily blamed on stress or aging. High blood pressure damages arteries and organs over time. If you're over 40 or have a family history, get your blood pressure checked regularly. Early detection and lifestyle modifications, like diet, exercise, and stress reduction, can stop complications before they start. 2. Type 2 diabetes. Type 2 diabetes often develops gradually and silently. Your body becomes resistant to insulin and blood sugar levels rise without causing pain initially. Early signs may include increased thirst, frequent urination, and fatigue, symptoms easy to dismiss as dehydration or aging. Some people notice slow healing, tingling in feet, or blurred vision. These changes may take months to appear. But untreated diabetes damages nerves, eyes, kidneys, and heart. If you experience any of these subtle symptoms, especially if you have weight gain, sedentary lifestyle, or a family history, request a fasting glucose test or A1C from a doctor. Early diagnosis can prevent major health crises. 3. Non-alcoholic fatty liver disease, NAFLD. NAFLD is one of the most common chronic liver conditions worldwide and often shows no symptoms until advanced stages. Fat accumulates in liver cells due to obesity, insulin resistance, or high cholesterol. Early signs might include mild fatigue, vague upper right abdominal fullness, or swollen abdomen, a feeling easy to disregard. Without symptoms, most people only discover liver inflammation or fibrosis on routine tests. If you have risk factors like overweight, type 2 diabetes, or high triglycerides, ask for liver enzyme blood work and ultrasound. Lifestyle modifications like weight loss, healthy diet, and exercise can reverse early NAFLD before irreversible liver damage sets in. 4. Hypothyroidism, underactive thyroid. Hypothyroidism can stealthily slow down your metabolism and bodily functions. Early symptoms are often subtle and mistaken for stress or aging, fatigue, cold intolerance, dry skin, slight weight gain, constipation, or mild depression. These symptoms evolve slowly over months. Unless you test thyroid-stimulating hormone, TSH, levels, you may never know. Untreated hypothyroidism can lead to heart disease, high cholesterol, and decreased cognitive function. If you notice persistent tiredness, mood shifts, or changes in digestion and hair, consider a thyroid panel. Medication and lifestyle adjustments can restore balance before complications develop. 5. Sleep apnea, obstructive sleep apnea. Sleep apnea often goes undiagnosed because you don't feel pain, you just feel tired. The condition causes your airway to collapse during sleep, leading to breath interruptions. Common signs: loud snoring, morning headaches, gasping or choking, frequent nighttime urination, and daytime fatigue or irritability. A bed partner may notice pauses in breathing. If ignored, sleep apnea increases risk for high blood pressure, heart disease, stroke, and type 2 diabetes. Even without weight issues, it can affect anyone. If you experience daytime drowsiness or have sleep disturbances, ask for a sleep study. Early diagnosis with CPAP or lifestyle changes can drastically improve health. 6. Osteoporosis. Often called the silent disease, osteoporosis causes bone density loss without symptoms until a fracture occurs. Many people don't realize bone thinning is happening until a fall or sudden back pain from vertebral collapse. Warning signs might include gradual loss of height, stooped posture, or mild back discomfort during movement. Postmenopausal women, older men, and people on long-term corticosteroids are at increased risk. A bone density scan, DEXA, can detect early bone loss. Intervention with calcium, vitamin D, weight-bearing exercise, and medications can prevent fractures and maintain mobility if you act before a break. 7. Glaucoma. Glaucoma is a group of eye conditions that damage the optic nerve, often due to elevated eye pressure, without causing pain or vision loss until the disease is advanced. Early signs are subtle, loss of peripheral vision or mild tunnel vision, gradually replaced by blurred vision or difficulty adapting to dark. Many dismiss these changes as aging or poor lighting. Regular eye exams with tonometry are essential, especially after age 40 or with a family history. Early treatment, eye drops, lifestyle changes, or surgery can preserve vision. But if detected too late, vision loss is permanent. 8. Chronic kidney disease, CKD. CKD often progresses silently until kidney function drops significantly. Early stages rarely present pain, but subtle signs include morning puffiness, mild ankle swelling, fatigue, and slight changes in urination frequency or color. These are easily ignored or attributed to other causes. If you have diabetes, high blood pressure, or heart disease, ask for a kidney function panel, e.g. FAR and creatinine, regularly. Early treatment, blood pressure control, dietary management, and medication can slow or prevent progression to kidney failure. Catching CKD early can preserve kidney health and avoid dialysis or transplant. 9. Colon cancer. Colon cancer usually develops without pain in its early stages. Symptoms often include subtle signs like persistent changes in bowel habits, diarrhea or constipation lasting more than a few weeks, pencil-thin stool, and minor blood in the stool or unexplained fatigue or weight loss. These are frequently dismissed as IBS, hemorrhoids, or stress. Regular screening, stool occult blood tests or colonoscopy, starting at age 45 or earlier with risk factors, is critical for detection before discomfort appears. Removing polyps early can prevent cancer development. If you experience these signs persistently, consult a doctor immediately. 10. HIV early phase. In the earliest stage of HIV infection, called acute or primary infection, symptoms can mimic a cold or flu, mild fever, fatigue, swollen lymph nodes, rash, or sore throat. Pain is not typical. After this phase, HIV can remain asymptomatic for years while damaging the immune system. Without treatment, it progresses to AIDS. Regular testing is essential, especially for high-risk behaviors. Early diagnosis with antiretroviral therapy, ART, preserves immune function, prevents opportunistic infections, and dramatically improves lifespan. Recognizing a brief flu-like episode and testing can prevent silent progression and stop transmission to others. These 10 silent diseases can quietly undermine your health without warning until it's too late. The secret is awareness. Subtle signs in energy, digestion, sleep, vision, and mood may be your body's lifeline. If you notice 2 or more of these indicators over weeks, see a doctor and ask for appropriate testing. Early detection gives you a choice and a chance to protect your future. Share this video to raise awareness. Subscribe for more vital health insights and hit the bell so you never miss our life-saving content. Listen to your body, it might be trying to tell you something. See you in the next video.